Okay, good. So our next scenario is the pneumonia in a 70-year-old man. Pneumonia in a 70-year-old man. In this particular case, you're an FY2 in the emergency department. A 70-year-old man has presented with a cough and shortness of breath. He has had the symptoms of fever, shortness of breath, and cough for the past 2 weeks. The cough is with yellow sputum. He has a cough with yellow sputum. So fever, cough, and shortness of breath for the past 2 weeks. He went to his GP, who prescribed antibiotics, amoxicillin, and he has taken amoxicillin for 1 week, still no improvement. Went to see the GP, who prescribed amoxicillin or antibiotics. He has taken them for 1 week, no improvement. He has diabetes and he takes metformin. He has high blood pressure, takes amlodipine, smokes about 20 cigarettes a day. Your task is to assess and manage the patient. Patient may ask the question. If the doctor says, we'll give you antibiotics, ask, will you give me the same antibiotics? Do I need to stay in hospital? There are the two main concerns of the patient. Do I need to stay in hospital? Will you give me the same antibiotics as the GP? Approach to the task, as usual, grips, take the history of the fever and associated symptoms, which was a shortness of breath and a cough. Then go through the differential diagnosis, the PMAFTOSA, the ICE, the effects of symptoms, then you summarize the main points in the history. So what are the differential diagnoses? Well, you present with a cough or a fever. That's going to be upper respiratory tract infection, viral, pneumonia, asthma, COPD, lung cancer, tuberculosis, because there is a cough and shortness of breath and for the last 2 weeks. So we're going to go for the common things. You may want to do a systemic review as well. Good. Then after that particular approach, after the history, you perform examination. In this particular station, you're going to find a Muse chart or a news chart. So you will not be given examination findings like this in a written form. You're going to have a news chart. So you better know how to read observations from the news chart. So this particular patient has got a temperature of 38, respiratory 26, saturations are low, 91% on air. The blood pressure is normal, but is slightly tachycardic. High temperature, tachycardic, low saturations. Respiratory is high, 26. Respiratory rate, 26. After that, you perform examination. So this one in here, it's not a diagnosis, it's examination, yeah? So we need the examination. So 1 second, if I skipped a slide. Yes, so this examination. What else would be an examination? Yeah, on an examination, you also need a respiratory examination. Respiratory examination. What will you find? Reduced, you'll be given findings, reduced air entry and the crackles on the right side. Okay, and the crackles on the right side. Respiratory examination, reduced air entry and the crackles on the right side. So it is on the right side. That's what you would find. Good. Okay, so these are examination findings, crackles on the right side of the chest and reduced air entry. Okay, then you have to explain the diagnosis. He has got a chest, he has got a pneumonia. What is pneumonia? Pneumonia simply means chest infection. But we need a chest X-ray to confirm. Okay, so you have got pneumonia, which simply means a chest infection, but we need a chest X-ray to confirm. Then they'll give you a chest X-ray, and this is a chest X-ray showing lower lobe consolidation. So you're seeing here, you can see the diaphragm. Here you cannot see the diaphragm. So there is consolidation on the right lower lobe. So it's got it. You explain to the patient that the chest X-ray has been done. It does confirm that he has got chest infection on the right side. What are you going to do? Your oxygen is low, so we're going to give you oxygen. We're going to do routine blood testing. Now here you need to know how to explain these in layman's term. Full blood count, that is blood test to check if you're anemic and also to check for some cells, okay, in your blood. Cells that fight infection, they may be high. Blood test to check how your kidneys and liver are working. Okay, so this is the LFTs That's liver, and the UN is kidneys. Blood test to check how your kidneys and liver are working. Blood test to check the signs of infection, the inflammatory markers, signs of infection in your body. Check your blood sugar, okay? And of course, check what? Your clotting screen, your tendency to form clot or to bleed, yeah? Then you need to do a chest x-ray has already been done. If you didn't mention, you have to mention a chest x-ray. The temperature is high, we need some blood cultures. We have to give IV antibiotics. Which antibiotics are going to give me, doctor? We have to give this patient coamoxiclav with clarithromycin because amoxicillin on its own has not worked. Okay, good. So, and it has to be intravenous antibiotics. Yeah, it has to be intravenous antibiotics. Okay, give paracetamol to reduce the temperature. Yeah, oxygen, routine blood test in layman's term, blood test to check if you're anemic or the cells in your blood, check for the cells in your blood, check how your kidneys and liver are working, check for signs of infection, okay, CRP, check your blood sugar and your tendency to form clots or to bleed. Going to do the blood culture to check for infection in your blood, give you IV antibiotics, and of course, you have to give paracetamol to reduce the temperature. What you're also going to give in here, IV fluids. Yeah, you give IV fluids to reduce dehydration. Okay, IV fluids to reduce dehydration. You notice this particular patient, we can change to the IV coamoxiclav. Yeah, IV coamoxiclav, we can give in here, of course, plus or minus what? Plus or minus clarithromycin. You're going to have to assess using the what? Using the CRB to assess for the severity of pneumonia. Okay. So what we can see for this particular patient on the CRB, the C is for confusion. It's not confused. R is a respiratory rate above 30, is less than that. The blood pressure is not less than 90. 65, the age is above 65. So instead of giving amoxicillin, which the GP has tried, we can give IV coamoxiclav. Okay, IV coamoxiclav, but as we said, it could be coamoxiclav plus or minus clarithromycin. Yeah, but we need to wait for the blood test to see what's happening in there. Yeah, to assess completely, to use a CAPE 65 for the assessment. Okay, so this is a pneumonia in a 70-year-old. Thank you.